It's so nice to be with you. Let me tell you, I know that all of us stay busy. We have lots of things to do, and I know that it's an extra thing for you to come out tonight to listen and exchange thoughts. I always learn something from the audience, so I hope we can share some things. One of the questions that you get asked is, do you want to be an organ donor? And when I moved back to Ohio a couple of years ago, in Ohio, they make you get a driver's license for there. They don't like the one in Missouri, so you have to get one in Ohio. So I went there, and the lady was behind the desk, and almost without looking up, she said, do you want to be an organ donor? And I said, no. And she did something on the computer. And then she said, do you have a living will? And I said, no. She did something on the computer. And then she said, do you want to donate $1 to the Second Chance Fund? And I said, the Second Chance Fund? I said, what's that all about? I told her no. And I said, what's that all about? She said, well, that's to educate people like you so you'll become an organ donor. And so it's like that. All of you that have a driver's license, and while those of us who are a little bit older, we're vulnerable to different things. But on the other hand, the ones that are at greatest risk are the young people who take driver's ed. And then they get asked, and if you remember when you first got that first driver's license, you were kind of nervous and you didn't want to do anything to upset the person you had to drive with and that kind of thing. And they get indoctrinated to be organ donors, and they're not given any information about it. So that's what we're going to talk about tonight. That's a photograph of Joseph in 1963 in St. Louis. Many babies died, and they were literally there were no treatments for premature babies. When I started, every baby less than 3 pounds and 4 ounces that had trouble breathing died. It was 100% mortality. And many other babies, even much larger than that, died. One that got a lot of notoriety was President Kennedy's baby, Patrick, who was about 5 pounds, as I recall it, died. There were no treatments. Babies died. So we started in '63, and really I think we didn't make very many advances till about '70. The ventilator that was invented for the premature baby had to be very precise and very sensitive. And that ventilator is the same ventilator that's used for everybody now, but it was invented that way. They, a little side note, in St. Louis, the McDonnell Douglas was a major part of putting people in space, and the like. So they had an expose in a Sunday paper about the astronauts. So I wrote a letter to Mr. McDonald. I said, dear Mr. McDonald, I said, you put astronauts in space, you record their blood pressure and do things. I'm here in St. Louis, and we don't have a way to do blood pressure on premature babies. Can you help us? And he sent 2 electronic engineers, and they came with their oscilloscope, and I had my stethoscope, and we went to work. We took the blood pressure cuff from the astronaut's finger and moved it up to the arm of the premature baby, and it was just the right size. And then we did a lot of relatively sophisticated electronics to get it. So, but we were the ones that invented how to take care of how to do blood pressure in premature babies. So we were a leader, certainly in Midwest and taking care of sick babies. And what happened then in 1975, when Joseph was born, Joseph was very premature. He's a tiny baby. You get some idea about his size. That's a half-inch adhesive tape that has that tape, that endotracheal tube taped in. This is the connection to the ventilator. And Joseph, when we would see if Joseph could breathe, he wouldn't breathe if we take him off the ventilator for just a little bit. He wouldn't move, he wouldn't do anything. So a brainwave test was done. And his brainwave test was flat, and it was consistent with cerebral death was the exact word on his chart. And so I read that, and I looked at Joseph, and I thought, he's not dead. What is this? So I get a hold of the neurologist, and he said, well, just repeat it. He said, I said, soon. He said, well, in a day. So I waited 2 days just to be sure. And it was unchanged from the previous one. And so I say, Harvey, what do I do now? And he said, some places they turn off the ventilator. I said, I don't do that. I said, I treat babies, some live, some die. And I continued to treat Joseph, and there's Joseph when he was 7. It was because of Joseph that I began to study the issue of brain death. I didn't start right away. It probably took about 6 months, and as Joseph continued to live and do well, I thought I'd better look into it. And so here I am, decades later, still looking into it and coming here to share some things with you. Father said, God is the origins, and that's correct. Read Genesis, the Colby Center. If you're not familiar with it, I encourage you to look it up, Kolbe. Their work has to do with creation and Genesis. God created everything, and he set it all in motion. Everything is reproduced, whether it be the deer or the rabbits or the trees or whatever it is. It's all reproduced. The only thing that's new in creation is the person. And God created the person in order to understand the person. You have to have a definition. In fact, of the matter is, if you're going to communicate with words, you have to have definitions of words. So the first thing you have to say is, well, what is a person? Well, each one of us is an individual. We're just one. I have this much space, and that out there is not me. I have internal metabolism. I have a relationship to the environment with breathing and the other thing. And then individual substance. We have human substance. The human substance is alive. It has vitality. The dog is alive and has vitality, but has dog substance. The rat has rat substance. The human person has human substance, in that the human substance is the unity of the body and the soul. It isn't just what you can see, but it's which is, we see the spiritual, but the physical is there. And during life, that's living substance of a nature, and our human nature is in some ways like divine nature, but not divine at all. It's just human nature, but we have attributes of God, but we can't do anything unless God concurs. And we are rational beings that we can think our way through things. The life is the substantial fact. You see how this substance is? It's the substantial fact of the soul-body unity. If you get nervous about soul and body, well then say at least physical and spiritual. If that makes you nervous, and I don't expect anybody here to be nervous, but you deal with other people, and then so the people can see the material, and most everybody will admit there's something immaterial during life. Created in the image and likeness of God, we're live on earth, the soul-body unity, from creation until the event of death. life on Earth is like a line that you can draw on the board. The line has a beginning, it has its ups and downs. The beginning of life is creation. God creates from nothing. And God set it up so the creation of the person has to do with husband and wife, a man and woman, but it has to do, and there's a time when the person begins, and that's creation. And we can know that creation has occurred at conception. At conception, we can see that first cell. We can see the nucleus and the cytoplasm and the cell membrane. And that creation, that newly created soul body unity substance, we know that the soul is there because of the activity of the soul. One of the activities of the soul is called the augmentative power, augment, to grow. So the person begins the unity of the body and soul. We know that conception at one cell becomes 2 to 4 to 8, so that in about a week after creation, a week after conception, there's about 100 cells, and nothing is added. And it's after that implantation occurs. I'll tell you something that you might not hear too often, is that as soon as pregnancy occurs, there's an early pregnancy factor. And the early pregnancy factor interferes with the rejection process, interferes with the immune mechanism, because the baby is foreign to the mother. And if that early pregnancy factor didn't happen, she would reject the baby. And so as soon as pregnancy occurs, and it happens before implantation, in the animals, it's been shown already at the 2-cell stage, the early pregnancy factor is there that interferes with the rejection process. So God interferes the rejection process there, but as soon as the baby's born, her immune mechanisms go right back, and that's why you can't transplant an organ from one person to another, because each of us is unique, and our DNA and immune mechanisms do not allow for organ transplantation. So in order to do a transplant, human beings find a way to overcome the immune mechanism, the rejection process. So life is a continuum from creation until the event of death. And death is an event. Life is as a continuum. Before that, at the event of death, what happens, the soul separates, and what you have left on earth are the dead remains. Now, there are vital signs of life. We can see the vital signs that when the vitality is there. Respiration, and respiration isn't just breathing isn't just movement of the air, but it's the exchange of oxygen in and carbon dioxide out. Circulation is a vital sign. Response to stimulation, the temperature. We have control of our temperature. We know if we get too high, that's called fever. You get too cold, there's only so much that temperature. So God makes it so that the temperature is kept at a pretty steady level. During life, there's an interdependence of cells, tissues, organs, and systems. The cell is the basic unit of biology. And groups of cells make up tissues. Groups of cells and tissues make up organs. And groups of cells, tissues, and organs come together to carry out a function, and those are called systems. In the human body, there are 11 systems. 3 of them are the vital systems: the circulatory system, the respiratory system, and the nervous system. Now, St. Augustine in the City of God wrote in chapter 11, between alive and dead, there's no room left for a third state in which a man is dying. For if alive, the time is before death. If he has ceased to live, the time is after death. It is clear then that he is never dying. We use the word dying. I try not to use it anymore. I used it at one time, but I try not to use it. So what I do myself is that before death, when somebody is very sick, it seems to be close to death. But my grandson, who recently died, about 4 days before he died, they called everybody to the hospital, and I think that they thought he was going to die that day. He didn't die for another 4 days. And so somebody can be close to death. Close to death is not death. Now at death, that soul-body unity is no longer. The living person is changed in substance, is substantially changed from the living person to the dead remains. There's a dead body, a corpse, a cadaver. It's without life. The soul separates. When the soul separates, what happens is the ordered structure falls apart. And the first time that happens, and when it first begins, it's called autolysis. Auto is self, lysis is Greek for destruction. And so it isn't that something else comes along at death and injures that cell, whether that be cell, tissue, or organ, but there's an orderly structure and process that goes on during life, and when the soul separates, the order falls apart and gets disordered. What happens is that the ordered structure, when the life leaves, it becomes like an enzyme. It digests. It's a self-destruction, a self-disintegration, destruction, decay, decomposition. All of these are manifest as the destruction. And of course, when a person is alive or dead, either one or the other, when somebody is dead, there are no vital signs. No, the temperature gets cold. There's no respiration. There's no circulation. There's no response. Death has to do with destruction. That word, destructured. So during life, there is the structure. At death, it's destruction. If the vital systems are functioning, there is structure. It's not destructured. The person is not dead. When not dead, we don't bury, we don't embalm, we don't cremate, and we don't excise vital organs. At least we ought not. Now, to protect life, a person ought not to be declared dead unless the respiratory, circulatory, and nervous systems, entire brain, since the focus is on the brain, not unless these three systems have been destroyed, is the way that we can protect the life of the person until death. Brain death is out there. They now call it neurological criterion. And basically, there are three parts of the declaration of brain death. One is the absence of response to painful stimulus. The patient that I talked to, the brother earlier, said when they did the test, there was movements of the arms, but they said that didn't count. That didn't count. That was a reflex. It doesn't count. Come on. There's absence of brainstem reflexes. There are 14 brainstem reflexes. They test about 5 or 6 of them. They test the ones that shine a light in the eye, and if there's no response to the light, touch the cornea, no blink. They put ice water in the ear to see if the eye moves, and they see if there's a cough or a gag. But it's an absence. Those are brainstem reflexes. They test 5 or 6, but there's 14 of them. They don't test the others. And then there's the apnea test. What is the apnea test? And it has nothing to do with sleep apnea. The test for sleep apnea is okay. That's okay. The apnea test is a very, very bad test. And they do it on the patient. And what do they do? The patient is on the ventilator. The color of the skin is like this. The heart's beating. They got circulation. And they take away the ventilator. And if the ventilator's going 20 cycles a minute, they take away the ventilator for up to 10 minutes. So it isn't they skip 1 breath or 10 breaths or 20 breaths. They skip 200 breaths when they do the apnea test. It cannot do anything to help the patient. It's only harmful. It adds risk. What are the risks? That they can die, their blood pressure can go down. Who ever heard of doctors doing this kind of things to patients? It's contrary to good medicine, and so all of you have to learn no to the apnea test. Brainwave test, a lot of people think that that brain death means flat brain waves. They're not required to do brainwave testing. Brain death was invented in 1968. In 1971, they removed that requirement for doing EEG. They still do it a lot of times, but they're not required. How do they do it? You know, the whole thing about the development of brain death is that there's an absence of science. There's no science in brain death. And the way they got rid of the requirement for doing EEG and brainwave testing, 1971, at the Mayo Clinic, they studied 9 patients. 2 of the 9 still had brainwave activity. They concluded no longer is it required to look for brainwave activity. There's no science in that. Science is the kind of thing where an observation is made and then more tests are done to substantiate or disprove the science. And you got to know, thousands of people die every day. They studied 9 patients. And then from that 9 concluded that there was no requirement for doing EEG. They still do it lots of places. But the patient that they called me about today, I think they did not do the EEG, but they keep the records from the patients. It's hard to believe they keep the records from consulting doctors, and you can't get them until afterwards. They say they won't release them until the patient discharged from the hospital, goes out of the hospital. So how about destruction of the brain? What they observe is an absence of those functions of the brain, absence of the response, absence of the brain stem reflexes, but it's an absence of function. It's not destruction. To understand it, if you go all the way to when someone is dead, there is destruction of the brain, and it doesn't function, and it won't ever function again. If you go the other way and observe the absence of function, whether it be the brainstem reflex or whatever other thing you test, it's an absence of the function, and it does not mean that there's destruction of the brain, much less that the person is dead. In brain death, the patient's on a ventilator, and that's important to know. The patient has to be on a ventilator. They have a beating heart, circulation, and respiration. Everybody who's called brain dead has that. The ventilator is a piece of equipment that we use, and it only delivers the air with oxygen to the lungs. It's a mechanical thing. The rest of respiration, the gas exchange, oxygen and carbon dioxide out, is physiological. Now, the ventilator moves the air in. An analogy might be you put gasoline into the car, like putting in the air. But in order for that car to move, there has to be an interdependence of engine, wheels, and driver kind of thing. So and then it's only when there's an interdependence of those things that it goes on. The ventilator moves the air in, and sometimes the people say, well, the ventilator is masking death. It's not masking death. What do they do in the apnea test? They disconnect the ventilator for up to 10 minutes. And during that 10 minutes, the patient must prove that he or she can take in a breath without the ventilator, or is labeled brain dead. Then it's legal to stop the beating heart, to cut out the heart and other vital organs. There's only risk, there's no benefit to the apnea test. And learn for yourself. No to the apnea test. Learn for your relatives, for your friends. Know that if you get in the hospital set up, anyone who does unconscious, not a ventilator, make it very clear that you don't want the apnea test. The apnea test has only risk and no benefit to the patient. When the patient is, to go back to the ventilator to make sure I don't forget it, the ventilator just moves the air in. That's all it does. The other phases of breathing and respiration, the absorption of the oxygen into the blood, the circulation of blood, the delivering of the oxygen to the tissue, the metabolism, the carbon dioxide gets back to the lungs. And the only way it comes out is because the living person pushes it out. God makes it such that our muscles for the diaphragm and chest moves the air in, and that's how we breathe, and the ventilator takes that place of that. But the way we exhale, whether we're like we are now or on a ventilator, the tissues get stretched and they have elastic properties. They're like if we had a rubber band laying here on the table, it wouldn't do anything. And if I stretch it, it will come back together. But where does it get the energy to come back together? It gets it from me. I provide the energy. Where is the energy for exhaling? It comes because it's stored, and it's stored only in the living person. If the ventilator's working, the life is there. And the ventilator only moves the air in, it doesn't move it out. A paper I just read this afternoon talked about the ventilator in and out. No, they don't understand it. And the ventilator and its ventilation, it moves air. There's ventilation in this room, movement of air. Respiration is the exchange of oxygen and carbon dioxide is what respiration. And sometimes the ventilator is mislabeled a respirator. They're both the same piece of equipment, but the ventilator is the proper term. Now, I didn't test this. I don't know if it's going to work or not. We'll find out. If it doesn't, I'll just tell you about it. But what I'm going to show you, hopefully, is procurement of an organ from a deceased donor. Deceased, and it's deceased by brain death, could be heart death as they call it. And you'll see the operation where the chest opens up and you'll see the tissues around the heart, and then you'll see the beating heart and the deceased donor. We'll see what happens. It's a chance.
An incision starting from the sternal notch to the pubis is made. The sternum is divided and the thoracic organs are exposed. The self-retaining retractor can be used, and the pericardium is divided to expose
See the beating heart.
The heart and the pericardial cavity.
The beating heart. This is how they
Falciform ligament is
See the
divided.
beating heart. They do all of this operation, and when they get down, it takes quite some time, maybe an hour thereabouts, for the operating to get down. And when they want to take it out, the transplant surgeon stops the beating heart. and lifts it out and quickly gets it put into into someone else. What happens when patient is called brain dead? If you treat them, they continue to live. I showed you Joseph. Joseph eventually married, has 3 children. TK was a 5-year-old boy that I took care of in Omaha who got meningitis and then was said to be brain dead. We continued to treat him. When he was about 15, I asked his mom, I said, Renee, is it difficult? She said, well, it's difficult when he gets a kidney stone because he has a lot of pain then. Just like everybody else that you might know, or if you had a kidney stone yourself, lots of pain. Jahai McMath got a lot of notoriety. Jahai McMath was a 13-year-old girl who had tonsil surgery in California and was said to be brain dead. Her mother got on the TV and pleaded, will somebody help? And it was about Christmas time, and one of my sons was there, and he poked me on the arm and said, Dad, what are you going to do? So I got a plane ticket. I went to California, to Oakland, to see her. They wouldn't let any doctors in to see her. So the way I got in was I got in about 2 o'clock in the morning, and her stepfather was on the other side of the guard, and I was on this side, and he said, oh, Pastor, come on in here. And that's how I got in. And Jahai was on a ventilator. They wouldn't even refer to her by name. They referred to her as a dead body. She had no nutrition for 3 weeks. They wouldn't give her any treatment. We got the treatment started, but we did it in such a way they wouldn't give her any medicine. So the mom pulverized the medicine, and she put it under the tongue. And not very many people have heard about it, and I know they never told anybody about it. But what happened to Jahai? She was declared brain dead by at least 3-4 doctors. They had a consultant come from Stanford who agreed that she was brain dead. She fulfilled all of the criteria for brain death. But we continued to treat her. She got transferred from California to New Jersey, where New Jersey has a law that says that if the relatives do not accept brain death, they can't call them dead until their heart stops and there's no circulation. So she was dead in California. They issued a death certificate in California. We got her to New Jersey, and she was alive in New Jersey. And she lived more than 4 years after that. And when she died of something other than her brain difficulty. Her mother would show pictures and photographs of her, and her mother would fix her fingernails, and they were that. And then they'd say, well, how do we know it's Jahai? Well, I tell you, I had a picture, and I didn't put it in here, a picture of Jahai's hand and my hand, and you could tell the difference, the distinct difference in color from Jahai's hand and my hand. And it was her hand. When her mother would say, give me a thumbs up, she'd be there in the bed, and up would come the thumb. Raise your left leg, the left leg would come up. And you got to know that before all of this, she was declared brain dead. And if there wasn't interference, love from her mom and her stepfather and the others, and help from some doctors, they had her organs taken out. Alan, it's more than 10 years now. Alan from Montana, almost drowned. He was declared brain dead. We got involved with his treatment and got him treated. He went home. They live on top of a mountain and kind of on a horse farm kind of thing. I went there in the summertime, so it was warmer, not so terribly cold like it gets in the wintertime. It's more than 10 years. He has 7 siblings between the mom and dad and the siblings. They They take care of him. Zach Dunlap. Zach Dunlap got a lot of notoriety, a 20-year-old young man who, on a four-wheeler, an accident and unconscious, not a ventilator, and they said he was brain dead. His cousin wasn't willing to accept it, so he kept on, and his cousin got him to respond to a stimulus. Then he had to convince the doctors because he was already declared brain dead. The helicopter was landing to take his organs. Had to convince the doctors that Zach was not dead. I went to Oklahoma to interview him. If you want to see the interview, you can just go Zach Dunlap, Determination of Death, and you'll see the interview that I did. All of the patients that I get involved with, they have a relative or someone who speaks up to protect the life of the person. People are called brain dead. They're not dead. They're all alive. That when they do die, if they die related to that, they die because they cut out the organs, or they die because they take away the life support. Again, to repeat, you have to know about the apnea test, and you have to share the experience with your relatives and your friends, and you have to say no to the apnea test. The law in North Carolina, and really in essentially all of the United States, but they're state laws, the laws are terrible laws. It's a terrible law. It has to get replaced. First of all, it says an individual who has sustained either irreversible cessation of circulatory and respiratory function or irreversible cessation of all functions of the entire brain. You can be dead by number 2, but alive by number 1. What is this? There's not more than one way to be dead. There's only one way to be dead. They put in 2. And then the determination must be made in accordance with accepted medical standards. In '68, the Harvard criteria was the first set of criteria. By 1978, there were 30 disparate sets of criteria published. And there's still not agreement, but what they're trying to impose on everybody is the Academy of Neurology guidelines. Here's what we would recommend. We would recommend this statute, and I encourage you to get a hold of the legislators in the state of North Carolina and to use this statute. It doesn't say an individual is dead, but it sets the minimum amount of destruction that you have to have before you call somebody dead. No one shall be declared dead unless the 3 vital systems, the respiratory, circulatory, and nervous systems, have been destroyed. It's pretty simple. And then the destruction shall be determined with universally accepted standards, not just accepted standards, but universally. It should be the same in North Carolina, South Carolina, Ohio, China, Japan, England. Death is the same, and the criteria and determination of death ought to be the same. So that recommended statute, it's solidly based medically and unexceptionable, ethically and religiously. It's only by this or equivalent wording can the courts, and I would say, and doctors, be prevented from further imposing undesirable definitions of death, independently of what the majority of citizens think proper. The majority of citizens answer that question, do you want to be an organ donor? They think you're dead. When you're dead, you can't donate any organs. Every organ that's taken comes from somebody who has a beating heart and circulation and respiration. And that autolysis begins in the heart and the brain very quickly when there's a lack of oxygen. It begins and it takes longer time in the other organs. But when the soul leaves, destruction happens. What can you do to protect yourself? We give out cards. We call them opt-out cards, and they're there to protect and preserve your life. And what does it say? It says, I direct all medical treatments and care including nutrition and water and hydration, including food and water, however administered, be given to protect and preserve my life. The most important thing, you have advanced directives. The most important thing the advanced directive should say, and the most important thing should say if you get in a hospital, I want to be treated. And what do I want? I want everything. Don't worry, you won't get too much. I want everything. I want to be treated. If you say I want everything, you have a chance. If you've signed an organ donor card and you're unconscious and on a ventilator, the law says that they have to notify the organ procurement organization that they have a possible donor. And they already have permission to take the organs because the person who said yes at the License Bureau, that's considered permission to take the organs. And there's not much anybody can do to stop it. Even in New Jersey, where the patient is that I'm trying to help currently. So it says you want to be treated, and it says don't hasten death. And it says don't do an apnea test. Already told you why not to do that. And it says do not take any organ for transplantation or any other purpose. The document that's signed to give permission to take organs for transplantation, it says transplantation, research, or education. So everybody gives that same thing. Some people will say, what about giving your body for science? It's the same way, transplantation, research, or education. And somebody said, well, I'm not opposed to educating. Well, how about this? On a fairly regular basis, they will have upper extremities or lower extremities, and a number of them, they'll put them together at a hotel, and the surgeons will come and learn anatomy and how to do the operations with those pieces. That's one of the things that can happen if you donate your body to science. If you do donate your body to science, make it very clear you want to be buried, because that's the way that God set it up, that to be buried. So that's the card, and you'll get some of those. In Romans 1:25, it says they exchanged the truth of God for a lie and revered and worshiped the creature rather than the Creator, who is blessed forever. In conclusion, then, a person is alive. There's a soul-body unity from creation until death. To be dead, it's a body without a soul. It manifests as destruction. No one ought to be declared dead unless the respiratory, circulatory, and nervous systems have been destroyed. Now, when declared brain dead, the taking of organs begins while the heart is beating. I showed you that. Beating with circulation and respiration. The question is, do you really want to be an organ donor? You can look at our website, and if you want to email me, you can get a hold of me, P.A. Byrne at lifeguardianfoundation.org. Now, I'll just show a couple of things. I'll show this next slide because in that wonderful ad that was put on the bulletin, it has some questions. Is brain death a valid criterion for death? Is it? No. Can you bury somebody who's brain dead? Beating heart, circulation, would you bury him? Oh. To take organs for transplantation, it's what's done. What happens when you cut out the beating heart? Kills the donor. Kills the donor. Every time a heart transplant is done, they clearly kill the donor. A whole liver, they kill the donor. If I see somebody that has received a heart or liver, I'm happy for them that they're alive. But I know somebody had to be killed. And there's lack of information for the donors, for the recipients. Everybody should have full and complete information. should have full and complete information before you answer that question. Do you want to be an organ donor? Are there financial conflicts in declaring brain dead? To just put it into context a little bit, in 2023, there was $66 billion was billed for organ transplant, of which the doctors got $3 billion. $3 billion. You say, well, that's just the transplant surgeons. The emergency room doctors trying to get them there. Most of the doctors, most of the people don't know the things that we've talked about today. They're all part of the system. The medical system used to be, and there's still a few doctors that are independent practitioners, but most are part of the system. The doctors are hired and paid for by the hospital administrators, and the hospital administrators do what the lawyers tell them, and they all follow the rules of CMS. CMS is Medicare and Medicaid, and that's where the directives come from as to what happens. And all the private insurance companies essentially all follow the same rules of Medicare. Are there financial conflict? Well, the financial conflict is that the young lady that I'm telling you about, she's worth between $1 and $5 million to the organ transplant industry. And if she continues to get treatment, it's going to cost money to treat her. By the way, the patients that I told you about, Alan lives at home. And it's expensive in the hospital. You get out of the hospital, it's not so expensive and it's not so difficult. I've taken care of a lot of patients on ventilators at home. And so are there financial conflicts? The conflict is whether you, like the one of the relatives that was on the phone with me this afternoon, saying I was depriving the other people of the organs from this patient. And I was unchristian because I was trying to protect the life of the person who can't protect her own life. Overdoses on drugs, they don't even know what drugs it was because the testing that we do for drugs are medications. And yes, fentanyl is a medication, but even the fentanyl that they take is laced with other things, and so they don't know what it is, and it takes time to heal. How long does it take for the brain to heal? Months, 6 months, 8 months for the brain to heal, and to cut out their organs 2 days or 4 days after they've overdosed, it's terrible, absolutely terrible. That's one of the saddest things, like this young lady who has gotten off drugs more than once, and the family all works to help her, and then they relapse, and when they relapse, they take the same dose that they were taking before, and it has a much greater effect. And then they stop breathing. The drugs that they use, and all the policemen, all the firemen have a drug called Narcan. Narcan helps them to breathe, but that's just till they get into the system, and then the system is set up to get their organs. The increase in donors is much greater amongst overdose of drugs. It's so sad to go. It's so sad to go through with all of them, but especially the overdose. Are the patient declared brain dead truly deceased? And the answer is no, they're all alive. Why was the federal government investigating recently? Well, they had 103 patients that they looked into from Kentucky, and 28 of them may not have been deceased when the organs were taken. There are ethical and legal questions. 73 had neurological signs incompatible with organ donation. So they're looking into it. You know what's going to happen when they look into it? They're just going to find a way to get more organs. They'll keep doing the same thing. At least that's what I think. I hope it gets better than that, but I'm not optimistic. There's a difference between organs and tissues. Organs, remember where they were with that organization, cells, tissues, organs. They're groups of different cells and tissues to carry out a function, and they have to have a blood supply, a continual blood supply, some more sensitive than others. But that's different from tissues. The tissues, so the organs that they transplant, the heart, the liver, the pancreas, the intestine, they all come from somebody who has a beating heart and circulation. The tissues are like ligaments and tendons, and you can just look at them. They don't have the same blood supply, and they don't need it. So they can get that after circulation stops. And then the cornea. God makes all of the parts of our body that need circulation except the cornea. The cornea doesn't have any circulation. If God would have put blood vessels in the cornea, we'd be looking through blood vessels. God was smarter than that. He made the cornea so there's no blood vessels. And where does it get its oxygen? From the environment through the tears. So the corneas don't get destroyed for quite some time after there's no circulation, hour, 2 hours, something like that. And then the other kinds of transplantation is one of a pair. So we have two kidneys. So one kidney, when it's taken, it doesn't cause the death. Although twice I've given a conference and somebody has come up and said, I had one of my kidneys taken out because I had disease in it. If I would have had one of my kidneys taken out to give to somebody else, I wouldn't be here, that kind of thing. So it's one of a pair of kidneys. A lobe of a lung, or part of a lung, can be taken, and a lobe of a liver. They can be taken without killing the donor. That doesn't mean they don't harm the donor, but it's without killing. And then there are some a part of a body, like a face. It's not an organ, but it's a part of a body. So the tissues, ligaments, tendons, heart valves, and cornea are tissues. Distinguish between organs and tissues. You can get tissues after there's no circulation. You can get tissues theoretically after death, and after death. But the only way you get organs is from somebody who is alive. The finances for organ transplantation, 24,000 individual donors per year, and then they get more than one organ. You'll always hear about help 7 people or something like that. And most of the organs come from people who are deceased, brain death primarily. They also use heart death. What they do with heart death is that they have a functioning brain, so they can't call them brain dead. So what they do is they take away the ventilator away for a period of time, and they observe what happens to the heart rate and what happens to the blood pressure. And then they have a score. They give it a score. It's called a Wisconsin score. And out of that Wisconsin score, they predict, when they take away the life support, that within 1 hour, they become pulseless, or 2 hours, whatever it is with the score. And in heart death, they don't wait. They call it heart death, but it has nothing to do with death. They wait till they're without a pulse, as one of the transplant surgeon said to me just about 2-3 weeks ago. So all they do is put a stethoscope on the chest, and when they don't hear anything, they say that's it. When they're without a pulse for 5 minutes, not without a heartbeat, without a pulse, without a heartbeat strong enough to give a pulse, that's the declaration of death. Then they have have the honorary parade that they do with people. They parade them in front of these people who have a beating heart circulation to say goodbye. I have one lady who worked at the hospital, and she would copy things for me. And I would take things to her, and she would say, "Dr. Byrne, may I keep this?" And she kept it. And her husband, they had the parade going past him. And then because of what she said, no. He continued to live. I saw him at home multiple times after that. $66 billion billed, and doctors got $3 billion. It's big business. Okay, I'm going to stop there.